Hi, my name is Dr. 𝗀𝒂𝒂🐐, and today we're going to discuss the top 5 ways to not get screwed on a personal injury patient. Let me set the stage for you. If you've ever treated a personal injury patient, I'm sure you've had one of these 2 scenarios happen to you. Number 1, you were not paid the max amount that you should have been paid for the treatment of that patient. And then number 2, and even worse, is you were never paid at all. Either of these can be extremely frustrating, and today we're going to dive into how to protect yourself from this happening to you. So the first way to protect yourself is to have a valid lien. If you're in a state that accepts attorney liens for treatment, you want to make sure that you know all the details that need to go into that lien that actually will make that lien valid. Patient's name, name of the firm, etc. Second thing, when it comes to payment, are there any state-specific lien laws that you need to know about that are going to dictate the apportion of payment when it comes to settlement? That's going to go to the patient, the doctor, and the actual attorney. And then finally, how do you attach or perfect a lien? That's just a fancy way of saying, how do you deliver that lien to the law firm so that it's a valid transmission of your documents to the specific firm? You might have to mail it certified depending on your state, or you might be able to just email that. So that's the first way to protect yourself when it comes to not getting screwed on a personal injury patient. So the second way to protect yourself and not get screwed on a personal injury patient is bulletproof notes. We all know how important documentation is. Well, it's even more important when it comes to personal injury patients and personal injury settlements. You want to make sure you're protecting yourself and you're tweezing every bit of information out of that patient to make sure that their whole entire story is told. You also want to corroborate your findings. So pretend you're a detective, you need to prove this case, and you do that by having bulletproof notes that are backed up by diagnostic testing, which can include EMG, NCV, MRIs, CTs, etc. And then finally, you want to relate the specific injuries that that patient is experiencing back to the accident if that's the case. If they have a pre-existing condition that was exacerbated, you want to make sure that that is in the documentation. And if they have a new injury as a result of the accident, you also want to make sure that that is documented in the notes. So the third way to protect yourself on a personal injury case is going to be have a relationship with the law firm. When you're treating a personal injury patient, obviously their quality treatment is going to be first and foremost, but you also need to do your due diligence and make sure you're vetting the firm that's representing them. That can be simple as looking at reviews online, asking members in the community if this is a reputable law firm or a reputable attorney that's repping your patient. And while you're in the actual case, you want to make sure you're communicating each aspect of treatment over to that law firm to make sure that they understand that you're managing that case properly. Finally, you want to follow up after the case settles. The case may be referred out to another trial firm. There's all different types of things that may happen after that case is actually done treating with you, and you want to make sure that you're setting up a system to follow up every, I'd say 3 to 6 months on the minimum to make sure that you're insured payment and that your lien and all your documentation is in the right hands. Okay, the fourth way not to protect yourself on a PI case and not get screwed is going to be work with medical providers. This is often overlooked, and it's extremely important that you're collaborating with the medical community to provide simple medications, even if it's just initially post-accident, so that they're getting what they need in conjunction with your treatment. Number 2, that they are able to write scripts in a lot of cases so that your therapy and your treatment is bolstered up by the medical community, showing that it is valid and necessary. Obviously, insurance companies are going to argue against that. It's very hard to do that when you have the third point, which is corroborating findings. You have your diagnosis, the medical community has theirs, you guys are on the same page, and you're doing what's best for the patient, and you're telling the patient's story in a parallel manner. Finally, the fifth way to protect yourself and not get screwed on a personal injury case is going to be quality treatment and understanding case management. Case management is going to entail everything from the organization of treatment to your communication with the patient, the law firm, and actually the medical providers on this case. You should really be the quarterback on this case, and you should be the conduit that everybody's going to. So this way information and treatment protocols are bottlenecked through you and your clinic, so you can keep an eye and you are organizing treatment for the best medical outcomes, but also for the best legal outcomes potentially as well. So if you're serious about growing the PI portion of your practice, PI Expert Secrets is going to be perfect for you. We've done a 12-week deep dive course all about personal injury, how to treat it, and how to manage and bring in new personal injury patients. This is going to be all about understanding the details that make you a practitioner in the space and putting in the hard work to bring those new patients into your office and maximize the value of personal injury in your practice. So if you're interested, please click the link below.